Red alert status is true of about 100 of our 169 towns. That's about 80% of our population.
The President's task force has been silent.
I don't think a lot of people take it as seriously as they should.
This is a respiratory pathogen that would typically spread in the wintertime. Now we're in that winter.
We have seen a surge over the last few days, and we are seeing some lines at certain testing sites.
You always want to be in school, with your friends, but I think you gotta, realize that can't happen now.
I think that there's a lot of what I've been saying, anxiety in the air. So not leaving the house. They're more fearful of everything.
I just would remind them and the coaches that there's no guarantees here. Safety comes first.
The outlook isn't great in the next couple months.
I just think it was too soon, and this is just showing us that you can't put that many people together yet.
Why is he penalizing us?
Don't, impale the rest of our industry for the actions of a few.
Last time around, we could bring in nurses and specialists from elsewhere. There is no elsewhere right now.
This is really the sort of eighth inning, if you will. I think this is the final stage of the acute phase of this pandemic that we need to get through. Unfortunately, it's going to be the hardest phase right now. We're in for a very difficult 2 or 3 months.
From WFSB, this is an Eyewitness News special. Coronavirus in Connecticut. Your questions answered.
Well, good evening. I'm Irene O'Connor. Welcome to this Eyewitness News special report. Tonight, we are taking the questions you've been sending us over the past few days through the Channel 3 app straight to the governor. We have received hundreds of them on topics ranging from vaccines to quarantines, from testing to travel, and from restaurant restrictions to schools and how long they'll remain open as the coronavirus cases just keep climbing. And a quarantined Governor Lamont joins us now from his personal home in Greenwich. So nice to see you, Governor, and thank you for taking the time to be with us tonight. How you doing?
Hey, Irene. Yeah, this is my quarantine bunker, and we're doing okay. It's a tough time for this state. It's a tough time for this country and beyond, but we're going to get through it together.
Absolutely. We're going to get to schools in a moment. We've got lots of questions about those. But first, within the last 2 hours, we learned a member of your state police security detail was diagnosed with COVID. Can you talk about that a little bit? And how is that person doing?
He's doing really well. The state police are amazing. I do spend a lot of time with them. They won't let me drive, by the way. So that's part of what we do together. And so that's one other reason I've got a quarantine. First, it was Max, our comms guy. And now this may be a little bit the norm going forward. We have a high infection rate around our state and around our country. And if you do come into contact with somebody who tested positive, step off the battlefield for a while. It's going to keep you safe, but more importantly, it's going to keep all your friends safe.
Absolutely. All right, let's talk about schools. We've gotten a lot of questions. We've already seen districts, including Waterbury, Shelton, and Hamden, announce they're going fully remote into January. Now, Milford High School won't have students return to school buildings until the new year. So, along with several other viewers, Tyler in Guilford wants to know, he says, is there going to be a certain point when Governor Lamont is going to shut the schools down?
I don't think so, Tyler. I look at Europe, for example. Let's say that France and Germany and England are a month ahead of us. They have a very high infection rate. As they've had to restrict more and more activity, the one thing they really prioritized was keeping their schools open, especially the elementary school. They found, and we have found, that masked in the classroom is not only good for your emotional health, good for your educational health, but it's also safe in terms of your physical health. So every jurisdiction is going to make up their own mind. And you pointed out a number of schools have decided to go virtual. But I think every week a kid can be in the classroom is a good week.
And on that subject, Andrea in Glastonbury wants to know why you've decided to leave that decision on closing up to the local and superintendents. And she asks, shouldn't the state make recommendations to school districts that protect public health of our students and staff above all else?
Well, I just gave you my guidance on the importance of in-classroom option for those parents who feel comfortable sending their kids there. But I leave it up to the local jurisdiction. Look, some schools have a lot of teachers who have got to quarantine. Some of them have problems providing the staff they need to keep the schools open right now. So I can't mandate that. That's up to them. But we are making accommodations. We're working with kids at teachers college students, getting them up to speed so that as needed after Thanksgiving, they can come in as apprentice teachers.
All right, so let's talk specifically about the Thanksgiving holiday next week. Lauren in East Hartford asks, she says, wouldn't it be a better idea to keep students and staff out of school and working remote for 2 weeks or longer after Thanksgiving? We know family visits during the holidays are going to happen and will amp up the positivity numbers.
Well, I am anxious about Thanksgiving. We knew that November is going to be a tough month. You've got elections, you've got flu season, and we're going to have thousands of students from around the country flying back to Connecticut and flying back to our greater region. And most of them are coming from states that have a much higher infection rate. So working with all of my neighboring governors, we've put in place really strict rules. You got to test before you can get on that plane. Hopefully you quarantine either before you get on the plane or after you get to Connecticut and test again. It not only keeps you safe, but it keeps your community safe. And that's why it's so important.
Another question about schools. Michael in Wellington sent this one in. He says, is it true districts lose funding, state or federal, if they close and go remote because of COVID-19?
Well, it's not a penalty. It's just that you don't need the masks, the gowns, the disinfecting, a lot of the things that we're providing schools so they can stay open safely. But if you decide you feel more comfortable closing your school or going all virtual, we can redirect that PPE to places that really need it.
All right, so we learned yesterday the CIAC is postponing the start of winter sports. Knowing what you know, are you optimistic at this point they'll get a partial season?
I think so. Look, I think they made the right decision. You have to make some compromises, especially if you want to keep your schools open. I think, the high school sports, there's a lot of room for a spread. We found that in some of the sports. So, yep, they're going to postpone the start of that season until January. Am I confident they're going to be able to play sometime this winter? I think so. We see real progress being made on therapies and on vaccines. So we prioritize that and do what we can to let them play safely.
All right, Governor, stay right where you are because we're coming up next and we're talking testing. All right, we're talking testing now with the governor here in our next segment. Chances are you or someone you know has been waiting in a very long line. We're going to continue now. Before we get to testing, though, a question about PPE. Do we have enough in our state stockpile now to ensure all healthcare workers who need it have it and can feel safe treating patients?
Yes, I think the answer to that is yes. Let's face it, back in April, May, there was no national stockpile in Washington, D.C., and we were scrambling just to stay ahead and make sure that we could keep our frontline workers safe. This time around, Josh Jabal and our team have done really good. We've got at least a 90-day stockpile. Our hospitals have a stockpile of masks and gowns, doing everything we can to make sure that if we get hit again, as we're getting hit now, you can react safely.
We're hearing that some of the nurses actually don't have enough of it. If they don't, is there something that they can do?
Yeah, I mean, in the hospitals, in nursing homes, they provide the PPE as needed, but we're there as a backup as needed. So if you're running out, you've got a problem, you misallocated it, call us. We'll make sure that you can provide the masks and gowns you need to make sure your nurses are safe.
All right, now let's get to testing. Christina in Bristol is asking, what is the plan to reduce wait times at testing sites? Even as a healthcare worker with an appointment, I waited 3 hours at Midstate drive-up testing site. Most sites are experiencing the same long wait times. We saw a lot of that today, even in Middletown, Governor.
Again, back in the spring, we were doing 20 tests a day. Now we're doing 20,000 tests a day. We're doing more tests than just about any state in the country per capita. But you're right, Irene. Now things are spiking up. People are getting nervous, and they're going to get tested more often. So we're going to continue to ramp up the testing as best we can. If you can, don't go at peak hours. And if you can, make an appointment. Go to some of the federally qualified health centers. We're going to nursing homes and testing people there. We're going to make sure that we test so we get ahead of this virus, not the other way around.
All right, let's talk about travel and testing now. The state rule is that you have to quarantine for 14 days if you've gone to a state listed on the travel advisory for more than 24 hours. Is that right?
That's about right. Or get yourself tested before you get on the plane and then after you get here. So you're right. If you can stay close to home, look, I don't want to ruin your Thanksgiving. You got the holiday season, but staying close to home is much safer. That's why virtually every state in the country is making sure you test before you can fly in and out, just so we're not stirring up the hornet's nest.
And Gary wants to know, he says, what good does it do to have a negative COVID-19 test 72 hours before arriving back here in Connecticut? Do we have any credible evidence that a person will not contract the virus in the 3 days following that test?
Yeah, Irene, that's why we say get tested again when you land here as well. So hopefully you're not getting on that plane infected. And then when you test, when you come back and you quarantine, at least until you get that test result a couple of days later, your family will be a lot safer if you follow those rules.
All right, very good. Thanks again, Governor. And again,